right, we are here today to launch your brand new book, Fake Patient. Yay, I'm so excited.
I'm excited too. I've been waiting a long time for this. Never in a million years did I think I would be launching a second book during this COVID pause, but these are the times. And I guess one of the silver linings about doing this virtually is that more people can join us than would be able to be with us in person, right? So that's something good. For those of you who don't know, my name is Beaven, and I'm here with my brand new book, Fake Patient. With me today is my daughter, Megan Hashem, who has agreed to be in conversation with me, and she is also masterminding all the technology because that definitely is not my strong suit. Thank you to everybody who's taking some time out of their afternoon to be with us here today. I really appreciate it.
So we're on several platforms. We're on IG Live, we're on Facebook Live. I think most of you are here with us on Facebook, and we'll be on YouTube after the fact, so you can catch it there too. Make sure you say hi, ask a question, leave a comment, just say, hey, I'm here. I think a lot of you guys are already, so that's exciting, because we will be doing a draw later to get your very own free copy of Fake Patient. We'll randomize the names we see in the comments and questions, and we'll do a draw for a book later on. That'll be fun. So make sure you get in there. So let's jump right in.
Okay.
All right, Fake Patient. 2 decades of simulating pain, sickness, and dementia. And on the back, it says, all part of the job for the standardized patients who recreate medical scenarios so student doctors can learn to deal with the care, crises, and conversations of their future real-life patients. Come behind the scenes as the author reveals life as a standardized patient with unflinching candor and deep reflection.
It's about my experiences of being a standardized patient, which I've done for about 18 years. And I brought you a hospital gown.
Great.
In case you want to feel like you're part of the
Perfect.
Part
Is
of the
that
whole
going to
thing.
get me in the mood for this book launch?
It might.
I don't know, Mom. I'll think about that. So, looking through this book, on page 8, it says there's a lot of names for what you do. Standardized patient, SP, standardized client, sample patient, simulator, and medical actor.
It does go by a lot of names, but the work is the same. We portray patients in medical scenarios so that student doctors, nurses, and other healthcare professionals can see what an interaction would be like with a real patient. That way they can practice their skills, try things out, even make mistakes in a safe, controlled learning environment without affecting real patients.
Mm-hmm. I think most people don't even realize this is a job. Is that why you wrote this book? Or I don't want to put words in your mouth. Why don't you tell us why you wrote Fake Patient?
No worries about putting words in my mouth. And you're right, that is one of the reasons that I wrote Fake Patient. A lot of people don't know that it exists as a job. When I mention it to people, they say, what is that? If they have heard of standardized patients, often their only reference is one episode of the old Seinfeld show. One of the characters, Cosmo Kramer, gets a job as a standardized patient. He has to portray a gonorrhea patient, and he goes all out with his performance. He puts on a maroon smoking jacket. He has a lit cigarette in his hand, and he talks about that night of lost love. It's a hilarious episode, but it is very far from what really happens in the standardized patient world. So that is one reason that I wrote the book. Mm-hmm. Another reason was that we all have to deal with doctors at one time or another, either for our own health, maybe when we're taking care of an older relative or a young child. So I think it's interesting to know what doctors go through in order to become doctors and how their training may impact some of their thinking. I think that might be valuable for all of us because we have to deal with doctors. I guess there's a third reason that I wrote Fake Patient, and that was to sort of be a celebration of what we do. Not that the people that I do this work with need validation that the work they do is important or that it is a real job, but I think it's just sort of nice to have that acknowledged. I mean, there are books about doctors and artists and writers and acrobats, whatever. So I thought it would be nice where people who do this work could see themselves in a book. Well, okay, that was a lot of words, but I hope it kind of answered your question.
Definitely. Okay, let's tell people where they can get this book.
Okay.
So you can go right to Pat's website at www.patbeaven.com, or I've put a link in the description of this video if you want to just click a link easy. So it's available both those ways.
Thank you, that's great.
So you've got a lot of questions coming in.
Oh.
Do you want to answer some of those, or do you want to read from your book first?
We can take some questions.
All right, okay. Let me just see. Okay, here's one. What's your favorite part of being an SP?
Oh, okay. There are lots of things I love about the job. My favorite part would probably be all the learning. You're always learning. My knowledge about medical things and medical vocabulary has exploded since I became an SP, and you're just always learning, and I really love that about the job.
Awesome. Okay, here's a comment. Dr. Zeroulis, I hope I'm pronouncing that okay, is saying, I've worked with SPs for years. It's interesting to hear about what it's like from the other side. It's clear from the book that the author has great affection for the work she's describing.
Oh, I like that.
The comment there.
And it's true. It's true.
I'm going to find you another question. Here's one that just came up. Chrissy D. Hi, Chrissy D. Do you have to be an actor to be a standardized patient?
Oh, that's a great question. Actually, there's sort of a whole chapter in the book that's devoted to that question. A lot of the skills that are needed to be a standardized patient are also actors' skills. Things like creating a character, memorization, collaboration, improvisation, portraying consistently. So those things are shared with actors and standardized patients. I would say maybe 2/3 of the people I work with as standardized patients are actors. But for the people who come into the work who aren't actors, well, they get a crash course in sort of applied theater 101 for sure.
Okay. Pamela wants to know, can you self-diagnose with your experience here?
Wow, that's a great question. I don't feel confident in self-diagnosing, but a lot of times, you might feel something and you'll think, oh, I did a role where that was one of the symptoms, so maybe I have that.
I hear a lot about that from you. You'll be like, could it be this?
I know, because you've played a character who has those symptoms, and look what happened to them. Also, friends say like, oh, I've had this cough for 2 weeks. It's a really dry cough. Did you ever play a character like that? Like, do I have to see my doctor? So I always send them to their real doctor.
Yeah.
But it is fun to know things and to learn things like that.
Can I give you one more question? And we'll come to more questions later, hopefully, right?
Sure.
Okay, so one more. Elena wants to know, if someone wanted to get involved, how would they get started?
Okay. Most universities that have faculties of medicine probably have a standardized patient program attached to them. And also there are private institutions, medical and scientific institutions that do run SP programs. So probably the easiest way to get involved is just to Google standardized patient. And I know some of the programs have online application forms. Then there'd be some kind of interview, and I guess you could get started in that way. That's how I got started.
Okay, awesome. So there's lots more questions and comments coming in here, but are you going to read something from your book now?
I could
We're
do
all
that.
waiting for it.
Okay, I could do that. It was a bit of a challenge to know what would be a good thing to read, but I've decided on something, and I'm just going to set it up for you a little bit so it'll make sense. It's going to describe one of the group scenarios that I work in as a standardized patient. It's a code call in a hospital. Hospitals have code calls with different colored names. You've probably heard them when you're in the hospital, code blue or code white. This is a code blue call, and code blue means that there's an adult patient that needs resuscitation, that needs life-saving help. So I work in a particular code blue call. I'll just tell you the backstory. I'm sitting in a hospital room with my adult daughter, who is not played by a human being, but in this scenario is a simulation mannequin who's under the sheet on a bed. And I've been sitting with her for 3 days. She's come into hospital after having a stroke. And all of a sudden, she starts to retch, her eyes roll back in her head, and she loses consciousness. So the nurse who's in the room with us starts CPR immediately and puts out the code call. So I'm going to read what happens next. And I'm reading from page 29. The code team rushes in. A couple of doctors, a critical care nurse, some other people. As they surround the bed, the doctor leading the code introduces herself and learns from the nurse what's happened. The code leader asks one of the doctors to take over chest compressions and delegates responsibilities to the rest of the team. Very busy, lots of activity. What's going on, please? This is awful. Please, doctor, my daughter needs help. I try to stay as near to the bed as possible, my cries of anguish adding to the organized chaos. Doctor in charge directs a team member to relocate me outside the room. No, I can't leave my daughter. She needs me. Compromise. I move to the side of the room, away from the bed, and one of the team members is tasked with supporting me, staying by my side and explaining what's happening. He asks me about my daughter and attempts to find out about any advanced care plan or DNR that might be in place. I try to spit out answers, but I'm not really taking much in. I just want to focus on my daughter in so much distress. Somebody has set up the equipment and monitors the feedback technology, heartbeat, clinical details, mechanical apparatus, lights on, some blinking, numbers, lines, graphs travel across the screen at the head of the bed. The team is calm as they communicate back and forth. Team members spell each other off doing CPR, pausing at intervals for a pulse check. Each time, there's no pulse. I keep trying to inch my way back to the bedside, imploring everyone to help my daughter. So much tension in the room. Epinephrine is administered. They decide a breathing tube is necessary, and I watch as someone tilts up my daughter's chin and depresses her tongue with some metal instrument so the plastic tube can be inserted into her throat. I squeeze my eyes shut and pray. More epinephrine, still no pulse. The nurse reminds the code leader that there's been no response for almost 20 minutes of CPR. But she's already thinking along those lines and opens it up to the rest of the team, asking if they have any suggestions. When there's some sort of consensus that rescue attempts are futile, the team leader announces, "All right, after this round of CPR, I'm going to call the code." She steps over to speak to me. I am frantic. No, please, you have to keep going. My daughter just needs a little more time. She can make it." They call the code. Rescue efforts stop. Machines are turned off. Now a crying wreck, I push my way closer to the bed. I grab the hands of the doctor who's been doing CPR and try to pull them back to make him continue chest compressions. I'm so distraught I barely hear the words, "Your daughter has died." Everyone stepping back from the bedside now, standing motionless. Such silence. Someone takes my arm and draws me nearer to my daughter's body. "Why don't you come and say goodbye?" I'm shaking, weeping. I gaze close up into my daughter's face and lay my cheek softly down on her still chest. My sobs the only sound in the room now. A moment. Then the facilitator's voice. "Okay, we'll stop there."
That was intense. Woo!
It is an intense scenario.
It's an intense job.
It is, and it's so good that those students, those learners get to practice being in that, like, every moment is important kind of situation. And of course, the added challenge in this particular scenario is that they have to do all that work with a family member present, which is an added challenge.
Yeah.
It's not always that intense, though. Sometimes as an SP, I'm just there as a physical body so that learners can practice different physical techniques. Maybe they're learning how to use a blood pressure cuff. Maybe they're testing for range of movement after an injury or learning to bandage an arm, something like that. Sometimes it's more of a talking situation. Maybe they're taking a medical history, learning about symptoms so that they can come to a diagnosis. Perhaps they're suggesting a treatment plan, or sometimes they might have to break bad news to their patient.
Yeah. Okay, well, should we do our giveaway now?
Okay,
Let's perk it up in here.
Okay.
Let's do a giveaway.
Oh dear. Okay, yes, we can do that. So if you haven't said hi or let us know you're here, if you haven't left a question or a comment or something, now's the time to do that. Is that right, Megan?
Yes, get in
Yeah.
there. I'm just randomizing all the names that have commented or said hi or anything, and we're going to pick a winner from the randomizer here in 1 second. So get your comments in if you want. Say hi, give us a smiley face, and we will be doing a few more questions maybe after. So if you have a question, leave it there. Here I go. All right. Lots of people saying hi. Hi, everyone. A lot of people looking forward to reading your book, and a lot of people saying they've read it and they loved it. So a lot of people got the early bird release last week, and
Yes.
they've already read it. And they're
Okay.
loving it, so it's exciting. I'm seeing everyone here. Okay. And I need like a drum roll or something.
Oh,
like
I don't know how to do that.
Okay, yes. And the winner is, I'm in suspense too, Jackie Howard. You're the winner of Fake Patient. So definitely make sure to message Pat your mailing address, and Fake Patient will get out to you this week, right?
Yes,
This week?
tomorrow.
Yay. Okay, so congrats, Jackie. That's awesome. All right. Do you feel like taking more questions now?
Sure.
Okay. Here's one. 1 second. I saw many ones. I was just 1 second. Let me get back. Catherine wants to know, can you tell us about an interaction you had with a student candidate that you felt was really impactful for you or for them?
Okay. Um, well, I had one, there are many, but sometimes we see learners when they're in the early stages of their career, their early stages of their education, and then we see them later on, 4 or 5 years later, maybe even when they're going into residency or something. And sometimes a learner will remember you for some reason. That always amazes me. But I had one person tell me, you know, you were my very first SP, and I remember something you told me that I never knew I did, and it's been in my mind ever since. And when something happens like that, you realize that what we do is important.
Yeah, that's cool. Yeah. Let me give you one more. Lindsay says, I bought your book on pre-order and was really interested in the section on giving feedback to students. So would you call standardized patients teachers?
Good question.
It's coming from Instagram here.
Good question. We're not called teachers per se, but definitely teaching goes on. Feedback is a very important aspect of being a standardized patient, but the feedback we give, in feedback we don't try to fix things. The feedback we give is not directive or didactic. We don't say things like, well, you really should have done this, or, oh, would have been much better if you had said this certain way. We don't do that. We just talk about how whatever the learner did or said impacted us, and they take the learning from that. Although sometimes we can do what we call teaching in role. So if a learner uses some term that we're not familiar with, medical jargon or something like that, we can just say, I don't know what that means. So that's teaching in role. So while we're not called teachers, standardized patients definitely are part of the educational model for student doctors and nurses.
Okay. Okay, so I guess before we go, I'm going to remind people how to get your copy, their own copy of Fake Patient.
Okay.
You go to www.patbeaven.com. I feel like a info. www.patbeaven.com. Or there's a link in the description here, and I will put another link in the comments maybe right about now.
Okay. Okay, so that's it?
I don't know. Okay. Do you have more to say?
Thank you, Megan, for doing this. Thank you so much.
It was fun.
For being here with me. And so much thanks to everyone who took some time out of their very busy lives to spend a bit of the afternoon with us. I really appreciate it. The only thing that could have made it better was if I could have seen all your beautiful faces in person, but I did feel the energy coming into us or going out to us, so that made it very special. Thank you for being here. Thank you for doing this, Megan.
Thank you all. Cheers. Cheers. Now do I get to do my dance?
Did you like?